So first of all, as far as what we're calling our epidemiologic criteria, if you look at the last 2 weeks, we have seen a rise in cases. This graph doesn't look nearly as dramatic as what you'll see on the website because the rise occurred prior to the time frame shown in here. But you can see that we are continuing to see more cases. Secondly, on the bottom half of the graph, you can see that our percent positivity has been rising as well. We are doing more testing. The good news is that we are very glad to see that our testing rose from about 10,000 tests per week done in early January to over 18,000 tests reported for the week prior to last, and over 15,000 reported for last week. So we are seeing an improvement in testing. That said, our percent positivity is well over 5%. We're now at about 10.8%. So we failed this metric, if you will. Things are not going in the right direction as far as our percent positivity. Next, if you look at our what we call syndromic criteria, so these are people coming into the emergency department with a syndrome or a bunch of symptoms that could be COVID. And we look at this data because we want to see, number one, the burden on the hospitals in their emergency departments, but also an indication of who, not just how many cases there are. Many cases are mildly ill. These are people who are sick enough that they're showing up in the emergency department. And you can see on the top graph there that we have seen an increase in the number of people coming in to the emergency department. It met our metric of fewer than 20 on average during that 2-week period, but you can see it's increasing, and we realize that that is not a good indicator, meaning it is not showing us fully the trend and the way things are going, which is generally up. The lower graph also shows of people being seen in the emergency department with these symptoms, how many are getting to the mid of the hospital. And thankfully, although we have seen a rise in hospitalizations, it has not been as dramatic as what we saw with the first wave. I think you know that that's news nationally as well as in Idaho, more of a disconnect between the number of cases going up and the burden on the hospitals. What's not shown in our metrics, and I urge you to go check our website, is you can see, though, we are seeing a rise in hospitalization almost entirely here in the Treasure Valley. If you look around the rest of the state, they are not yet seeing increases, but here in Treasure Valley, they have seen some increase in cases. And the CEOs of the hospital spoke to this just a few evenings ago at the District Health Department meeting, and some of you may have heard them speak. Lastly, we have the healthcare, what we're calling healthcare criteria. Obviously, these all kind of fall into that bucket to a certain extent. But this is intensive care unit beds and ventilator beds that are available, and you can see that we still have over 100 ICU beds available and over 400 ventilators available. Again, partly because the people that are getting tested and getting diagnosed are not, in general, as severely ill as what we saw in the first wave. We also have a better supply, I should say, of PPE. We're hoping that doesn't change as we start to see more cases, but for right now, we have a good, solid 10-day supply of PPE available to the hospitals for the present time. And then lastly, we are seeing healthcare workers. We talked about this 2 weeks ago. We are seeing more healthcare workers that got infected over the last several weeks, but that trend has started to come down. As we talked about last time, we believe that, and this is from the investigators that are interviewing these patients, this is also what the hospitals are telling us because they interview their employees as well who are diagnosed, that this is mostly community acquisition. These are generally younger adults who have been out in the community, just like the rest of us have been going out and about, and either through their household, family members, or through other exposures are getting infected. Nonetheless, what this speaks to is if we have, even if they're getting infected in the community, and it isn't implying that they're getting sick at work, it still means that they're out of work. And so it is really stressing the hospitals to see their workers get ill, and we're happy to see some improvement in that measure over the last 2 weeks. We do have additional information available on the website, and that is really important information that we look at as well. And most recently, we've added the number of persons in the hospital on every day, and I hope that is helpful to you all. We've been very happy to now be able to have good, robust data on the number of people in the hospital and the number of people in intensive care, which is a very important indicator that was not available when we created the metrics. But we've talked about whether going forward we might adjust our metrics and start including this information formally into our metrics process. But rest assured, we look at that. We are very aware of the rising rates.